it is my distinct pleasure to introduce a featured speaker on the topic of maternal health. Camilla Brown is a former state representative from Orange County who championed the legislation that extended Medicaid for new mothers to 12 months postpartum. Today, she is Senior Director for Healthcare Transformation at Sunshine Health, where she gets to continue a focus on maternal health through a different lens. And she'll share a brief address on our human voice, speaking up for maternal health. Welcome, Camilla. Over to you.
Thank you so much. And good morning. My name is Camilla Brown, and I serve, as she mentioned, as Senior Director of Healthcare Transformation here at Sunshine Health. And so it's truly an honor and a privilege to join each of you today. I want to extend a heartfelt thanks to the board members, Madeline and her team, and to my dear friend and former colleague, Vance, who, when it came to children, he supported me and pushed me every step of the way during our time in Tallahassee. And so for that, I say thank you for your continued support still today, but most importantly, your friendship. And so my time in Tallahassee was a special one. It is where, as our former First Lady, Michelle Obama, would say, this bright-eyed young lady, eager to truly make a difference in this world, would become. So I got my start in advocacy while accepting an internship with then State Representative Arthenia Joyner, who was a pioneer and political trailblazer throughout her career as an activist, as an attorney, and later in life, a lawmaker. Now, in my years of working with her, I learned the importance of advocating for women and children, but more importantly, leading with my conscience and my convictions, and to never be afraid to speak up on issues that mattered. Even if I had to stand alone or be that lone voice, it was my duty to tell the story. But as I continued my time in Tallahassee, I evolved and through experience and working and meeting with stakeholders and mastering my craft within that space, I began to truly understand the importance of lived experiences, relationships, and collective voices. Just truly the importance of partnership and the lesson that the win of one is not the loss of another, and that a closed mouth is a closed destiny. If you know my testimony, then you know exactly what I'm talking about. That who knew that within my passion and through my grief, that I would end my 20-year bout in Tallahassee accomplishing one of my greatest accomplishments. And that is what ignites me and reminds me every day of my why in my new role here at Sunshine Health. Now, we know it's quite clear that a large driver of our problems that we see with our families is economic insecurity. It's adversity, it's lack of a support. And so we as stakeholders have become increasingly aware of that by beginning to sort of break down the characteristics and data and really begin to be more specific in the solutions that we are developing when we're seeking to address those needs for today's families. Families struggle with adequate ways of really how to support that child when it comes to quality education, healthcare, including mental health and wellness, the intersectionality of social and environment, as well as social justice and racism. These are those intersectionalities of what causes some of our challenges and barriers of families, and that hinders them to be able to thrive and to grow within our communities. And so it is here in my role at Sunshine Health to seek to address some of those drivers of health for our moms and strive to set them up for success from pregnancy to birth, even through postpartum. Sunshine Health provides healthcare coverage for pretty much every stage of life. So whether you're just a young adult starting out, a new mom, or a grandparent who needs that extra support to continue to live independently. And what I love about being here at Sunshine Health is that we have those shared values, and they go just beyond providing healthcare coverage. For example, what I love is they have 11 welcome rooms around our state that serves as community resources and gathering places for Floridians to connect to social services, health and wellness classes, support groups, health fairs, baby showers, you name it, it's there, right? They believe in being an active member of those communities that they serve by helping those that are our most vulnerable get the access they need, but more importantly, that they deserve. We partner with over 600 community partners across the state to help not just our members, but people with everything from food to clothing to childcare, and even at times safe and affordable housing. And so at Sunshine Health, there are several initiatives and programs that are currently in place to help Florida's moms uh, set up a life to thrive, not only theirs, but their babies. And so one of those initiatives is our Smart Start for Your Baby program, which addresses those gaps in providing care and support for that pregnant woman and new mom during her pregnancy and even up to that baby's first year. So for context, almost half of our births here in Florida in 2021 were done or covered through Medicaid. And so this is why we rely heavily on community partners and programs to help us support better health and better outcomes for our moms. It's a critical mission here at Sunshine Health to really bridge these gaps and alleviate these challenges for our moms to allow them to focus on not only their health, but also their baby. And so back in 2021, I proudly led bipartisan legislation to extend postpartum Medicaid coverage for pregnant women up to 1 year after delivery. Now, Medicaid coverage for 1 year fills a major coverage gap in maternal health. 1/3 of pregnancy-related deaths occur 1 week and 1 year postpartum, with 12% of those pregnancy-related deaths occurring after that 6 weeks postpartum. Now, me personally, I lost quite a few family members, or not family members, I lost one family member, but quite a few friends who were taken away from us and was not able to go home with their baby just due to, pregnancy complications after birth. And so while access is a critical component to really advancing maternal health outcomes, that's not the lone solver. It's just not enough. Becoming a mom in 2020 for the first time, it really fueled my passion to do everything necessary to pass legislation to help with many of our maternal health policies that we as a state ignored for years. And so being a parent in the middle of the pandemic, having lack in support and adequate care prompted me to introduce legislation also to establish a telehealth program, which we now have that telehealth program for pregnant moms across our state. Maternal health, was previously one of those concerns that we had there, solely with our Department of Health. And it was covered and prioritized through our Office of Minority Health. And so it was during my service, it became a key issue of the Florida legislature. Now, while we have moved the needle in advancing maternal health here in Florida, we still have a ways to go towards ensuring the health and well-being of our mothers and children. And so as stakeholders, we must keep pushing for comprehensive policies that cover the well-being of that child from 0 to 5, and policies that speak to those communities and includes input from all voices. And I look forward to collectively achieving that goal with each of you. Thank you so much for your time.